name is Cassandra UpChurch. I was with the Bloodless Medicine program at Penn Medicine. And so the objectives for this lesson, let me make this smaller, is understanding the purpose of bloodless medicine and the program itself, the understanding of the nurse's role in the patient blood management in the bloodless medicine program, review of benefits of the nurse's role, and the interdisciplinary care planning. And so bloodless medicine in a nutshell is care that does not use blood transfusions. And so typically what our patients are asking is that, of course, they're not declining care or medical treatment, but they're just asking for the option of blood transfusions not to be a part of the treatment plan. And so the program as a whole is designed to facilitate and implement processes to identify bloodless patients and strategies, implement strategies to eliminate exposure to blood transfusions. And so as brought out before, blood transfusions are not an option under any circumstances as long as these patients are enrolled in the program, which is why we work so closely with them. And so these patients are refusing the red blood cells, white blood cells, platelets, and plasma. But instead, what we also offer is alternative strategies and derivatives to be a part of their treatment plan, since we know that obviously those components are not an option. And so it's really important that these programs are designed and we're there to help to respect the patient's decision and offer care that helps the patient to have good outcomes, even without the use of a blood transfusion. And so the programs really provide a lot of support to other care teams in the hospital and the clinical programs, and that it does increase patient engagement. These patients do seek out programs that have bloodless medicine programs because obviously they're not accepting transfusions. And so it's important that they're somewhere where it's understood what their decision is to not accept blood, but also that agency or facility is trained to and equipped to manage patients without that type of support. Also to identify patients and track them, facilitate care through referrals, recommendations, and education, which is a huge part of the program. Provide and participate in research, because of course the things we learn through what we do, we do like to share and publish. That way, we can all benefit from it and improving our practice. Because it does make us better providers to not use the resource of a blood transfusion to care for our patients. And also, of course, decreased blood utilization and impact on outcomes at hospital stay are improved as a result. And so as far as the nurse role in general, we know, of course, nursing makes up a huge part of healthcare globally. They make up 59% of healthcare professionals. So nursing, along with many other care providers, are actually the backbone of healthcare, and it couldn't exist without those disciplines. And so, of course, being that it's such a large profession, it's not surprising that nursing will be present in the departments such as bloodless medicine. And one of the benefits of a nurse being present in the department and that type of organization is that it ensures communication across disciplines as well, because nursing is so multifaceted. So one of the important things to consider is that when we talk about interdisciplinary teams, there's a lot of components that go into making it successful. And so this isn't anything, it isn't different for a bloodless medicine program. And so being that it is a part of the interdisciplinary team, of course, one of the major focus is that it's going to be patient-centered, especially in a situation where we have patients that refuse blood transfusions, especially for a variety of reasons. That reason can be variable, but we do have patients that mainly refuse for religious reasons. And so we want to make sure that as a team, we're working collaboratively with our patients, with the family, with other care team members as well. And so it highlights too, especially when you look at this diagram and how important it is to make sure that this outcome is successful for the patient or working together, that the role of the nurse is important to help facilitate this outcome. And so when we talk about all of the roles that go into bloodless medicine to make it a success, of course, we know all disciplines are necessary to make it successful. There's not one discipline or one person that can make it successful, but the focus primarily for this presentation is on the nurse. But it's necessary to implement and have involvement and support of all disciplines, because of course the nurse touches every discipline. And so you see the impact that nurses do have on the bloodless medicine role. And in some cases can be interchangeable or thought of as a patient advocate, a provider advocate, and a care advocate as well, when they're able to communicate and work along with administration, clinical staff, and ancillary staff. Because in a lot of cases, this education and the communication across these disciplines and levels of care typically will happen through the nurse, as brought out previously in other presentations. A lot of times the nurses or the nurse coordinator is responsible for giving recommendations, which is a huge help to the patient and providers to bridge that gap between education and understanding and resources and implementation. Now, when we talk about the nurse coordinator, the roles of the nurses in bloodless medicine include coordination. The responsibility can vary, and the role encompasses much more than coordination. And typically, the title of the nurse will vary, even though nurse coordination is a very basic and common responsibility for any nurse. So that's typically included in all nursing roles, even in some cases where the title itself is, nurse coordinator. But it's typically a core requirement and responsibility and skill of any nurse, especially functioning in this program, which is an added benefit to the bloodless medicine program. Now, when we look at nursing roles in bloodless medicine, we hear all kinds of different titles. There's variability also when you look at, PBM programs as well. But typically in bloodless medicine, you'll see a few different roles, even though there's additional responsibilities. But at its core, nurse coordination is a big part of it. So you'll see the role as the director, which has more of an administrative component added to it, as well as your operations manager and manager role. And then you have titles such as our nurse coordinator that might be assigned, even though it encompasses much more than this. But again, it becomes a basic or a very routine function of the nurse, which is an added benefit to the program. And so when you look at bloodless medicine as a clinical program, it's very interesting, especially for the nurse, because these are many of the services and benefits to having a program, especially when you see it function in this respect. And so especially when you have the nurse as part of this program, it's unique on both ends in that they understand the implications of giving blood versus not giving blood, and having been on the caregiver side, administering blood and monitoring these patients firsthand. And so having a nurse coordination in the department to be able to advocate and support patients refusing blood, but also participate in the listed services here definitely helps establish the program as a clinical program, but also supportive to the rest of the clinical team, and that they are now a part of the care team for that patient that is enrolled in the program. And so as the nurse coordinator, it makes this nurse relatable in talking to providers to be able to have these clinical and supportive care conversations, making it easier to connect the dots across providers and care teams. It also helps in that they're able to make a connection between liaisons and volunteer groups such as HLC and PVG and other programs. In certain cases, when they're connecting with other hospitals for services that maybe our organization doesn't offer, that's definitely an added benefit. Patient and provider recommendations and referrals definitely impacts the volume, in that typically patients who are bloodless patients will seek out these facilities, but they're typically touching base with the bloodless medicine department first to ask if there's any providers at that organization that's willing to provide care to them as a bloodless patient. And so typically that helps prior to and after admission. And so the nurse coordination piece isolates one of many features of the nursing role, but even when, in this case, it helps navigate the patient into and through the system, but it usually starts before admission and continues beyond discharge, which has a positive impact on patient engagement. And also the involvement in additional committees that really help to impact workflow, SOPs, and education on an organizational level as well. And of course, most importantly, data tracking, which really helps us to see how well we're doing what we're doing, what does work, what doesn't work, especially from the Bloodless Medicine Program perspective. And when we look at what goes into all the components and the complexities of having a bloodless medicine program that functions appropriately, there's a lot of main pieces, but then there's all these smaller pieces that take part or contribute to it as well. And so when we look at all those pieces, you notice that the entire team has an impact on each piece, but especially the nurse coordinator as well, ensuring that these pieces exist and are carried out effectively, especially in your comprehensive and more mature bloodless medicine programs. And so when we talk about patient identification, typically that's a proactive approach. Typically, that component has a lot to do with outreach. Patients are typically identified prior to being admitted to the hospital, but even on admission as well. So that's an important piece. So I'll just highlight a few pieces since you can see this. And looking at administrative support, the nurse coordinator has a big role, or the nurse in that department has a big role in meeting with administration and discussing the outcomes and the needs of the department, but also really making sure that the bloodless medicine department is visible, even to administration, to justify the need for it and the reason that it does need to exist in the organization. And when we talk about documentation, that's a huge part for the nurse coordinator as well, as it is with any patient that we provide care for. And data metrics, ensuring that we're able to trend labs and outcomes related to what we do and how we treat patients, especially in cases, for example, a lot of organizations now have anemia clinics associated with it. And so it's nice in that typically the anemia clinic will fall under the umbrella in many cases of the bloodless medicine program. So it makes it a lot easier to refer those patients, kind of help feed them into the system where they're identified as a bloodless patient. But now, because we're really meeting that patient ahead of time, we can assess their needs, we're able to also feed them through the anemia clinic and get that support as well. But we can track and see the difference in the improvement in their outcomes related to this patient coming in anemic or needing to be assessed for anemia, being treated and having their hemoglobin optimized, whether it's related to some type of chronic illness, blood loss, or even prepping them for surgery. When we talk about the anemia clinic, which the nurse coordinator typically does play a big part in, you can clearly see the need and impact for that role. And so, again, the role connecting the patient to providers, services, and resources, the anemia clinic being one of them. And so we talk about, consider all the tools you can use. Do you need to transfuse? And that's typically a big component, a helpful component, especially for providers, when the team, including the nurse coordinator, can really have a part in being able to have these conversations with the patients, talk to providers and encourage them, knowing their resources to assess for anemia, especially if you have a patient that's about to have be scheduled for surgery, but to utilize anemia management programs in anticipation of any type of invasive surgeries, or even as a part of the discharge plan, if you discharge a patient that's still anemic, even though they may be stable. And so just looking at the recommendations that typically most of your nurse coordinators would assist your providers with in preventive care, as far as maintenance, even after the patient is treated, to ensure that their anemia is managed on a long-term basis as well, but also in those acute phases too, to ensure that we are present to provide support and offer alternative strategies to avoid anemia and to in turn avoid blood transfusion for this patient as well. So again, it's a supportive care piece, but it's also a clinical piece that's an added benefit to the department as a result. And a big part of it is education development. And so when we talk about, and this is different for every organization, But typically in bloodless medicine, there's almost always a set of enrollment forms, even if there's variation in what those forms look like. But typically the nurse coordinator typically is developing those forms. That has a huge part in contributing to the development of those forms, which of course becomes legal documents, but also are legal documents, but also are helpful in providing options for the patients to be able to see options that are acceptable for them as an alternative to transfusion, but also so they know exactly what that agency carries as alternative strategies for their treatment to avoid that. Identifiers, of course, those being physical and electronic identifiers, have a huge part in developing that, and that there needs to be a way to flag these patients as bloodless, as well as their forms for all providers across the system. So that way, as the patient moves, every provider is aware that they are refusing blood transfusions and their alternative options as well. And so huge developments and those pieces as well. And one of the most important pieces is building trust with the patients and building trust with the providers, because again, the program, including the nurse coordinator, has a big part in building that bridge between the two, because sometimes those conversations are completely different. And so we think about, especially, for example, our Jehovah's Witness patients that refuse those 4 components: the red blood cells, the white blood cells, platelets, and plasma, and then our providers and their clinical knowledge. And sometimes that conversation is completely different on both ends. And so, for example, you may have a patient that comes in that's not clinical, and they'll tell the provider, we don't accept minor fractions, which is a common term that's used especially amongst our witness patients. And for the provider, a fraction is a fraction. Red blood cells are a fraction, platelets are a fraction, all those things are fractions. And so, with that, there being a gap in communication, that patient could end up getting a product that they were otherwise refused had there been clarification in that conversation. For example, getting plasma, because to this provider, plasma is also a fraction. So again, not knowing that that's one of the options that they refuse, but the patient also not knowing that a plasma is actually considered a fraction, just not an acceptable one that they would take. So again, there's a huge benefit to having the bloodless medicine department obviously involved in that case, but also the nurse coordinator to be able to have that clinical conversation with both the patient and provider to explain those pieces and to clarify it and to make it very clear what the refusal is, but also the alternative strategies, and to ensure implementation of that treatment plan. And so when we talk about patient volume, we talked about before how typically it helps with patient engagement, provider engagement. In a lot of cases, as I brought up before, there may be a lack of understanding on both parts. And that clarification really helps in that, especially if the patient feels reassured that we understand what their stance is, what they're refusing, what they're willing to accept, and have that support the entire time. And the provider has it very clearly explained to them exactly what those refusals are and what they're willing to accept. And the support of the team to help develop a care plan along with the patient that typically will contribute to increased patient engagement. And so typically we'll see a significant volume of patients that come to your hospital typically will be bloodless patients coming to the hospital because there is a bloodless program that's very active and a hospital that's engaged into the program and willing to treat these patients and respectful of their decisions as well. And education across the system. And so again, this education takes place with staff and patients, but of course, in most cases, not all the time, but in many cases, you will have a team of coordinators as well that may not be clinical, but are very resourceful, very knowledgeable, but it really helps in having the nurse coordinator on board and that they can help provide that clinical education to explain things such as the details regarding the fractions and maybe some other clinical components to help bridge that gap. And so it's really an education both ways, where the nurse coordinator can learn from the coordinators on the team, and they can also learn from the nurse coordinator as well. So that added clinical benefit helps the team, and administrative support, liaisons and volunteer services it helps as well in ensuring that updates are shared with these teams as well, but also that we're keeping them up to date on clinical trends and changes in the departments and how we're supporting the patients and what we need from them and what the patients need from them to support the patients as well. And so we talked about before, bridging education and understanding, which is, again, an added benefit. And that, again, the things that we do, the things that we're learning along the way, because it is individualized care, is very unique in its care tailored towards this patient, as it should be, because, again, they're asking that we provide care and treatments just without the use of blood transfusion support. And of course, connecting community resources. So we already know that if we get a Jehovah's Witness patient that's refusing blood, we'll always ask and offer, but typically there are resources in the community such as, HLC and PVG to support these patients, especially from a spiritual standpoint, and other resources in the community, sometimes related to, for example, our stem cell patients when it comes to funding in the community. So those things really help in bridging the gap between the two. And when we talk about the continuum of care in bloodless medicine, even though there's many more steps to it, and of course it looks different for every patient, not every patient enters the same way, not every patient is engaged the exact same way. But in general, when we look at the team as a whole, again, we talked about extensively staff and patient education, so understanding their patient's decision and supporting that decision and understanding the program and options. So that's important for both the provider and for the patient, and also the care team discussion regarding the patient's refusal, their stance in their care plan should have been very early on. The patient refusing blood transfusions, obviously identifying those patients and ensuring that those consent forms are done, but also that those identifiers, electronic and physical, are in place as a flag and a reminder that this patient refuses blood transfusions, and to initiate a way to impede any provider making the mistake of ordering blood for this patient. And also the review of the bloodless status with the care team, which should really happen throughout the hospital course, especially on the inpatient side, reviewing the patient's medication list, because it's more than just refusing to give a blood transfusion. It's overall care and treatment. So it's not just withholding blood, but also offering these alternative strategies and forms of treatment for these patients as well. And a big piece, especially for all patients, but especially bloodless patients, should be anemia identification, both short-term and long-term. And it's not just treating anemia, but it's also including, nutrition consult that typically comes with that package as well, to ensure that they're educated regarding how to make sure that they avoid becoming anemic again and can maintain that from a long-term standpoint and understand exactly what's going on, and looking at their past medical history, which can be a huge contributor to why a patient is anemic or why a patient does have prolonged bleeding. Those are things that we want to investigate and address. And of course, reviewing those acceptable blood fractions that the patient may or may not accept. So of course, these are just a few listed, but that list is a lot longer as far as alternative strategies or options that are available to these patients. And of course, follow up with the bloodless medicine department. So of course, there's that added benefit of, the team rounding, but also having rounds with a nurse coordinator as well to trend labs, look at pertinent patient data. But as I brought out before, especially for the nurse coordinator, that support and engagement with the patient typically will happen before admission and will continue well beyond discharge. And in summary, just wanted to highlight that all disciplines are necessary to have a successful bloodless medicine program with improved outcomes, because obviously all these programs are showing that it can be done. We're seeing the benefits of all those outcomes with our patients. The nurse has an important role in facilitating education, research, workflow, and processes, and that is a multifaceted discipline and role, especially for the department. The continuum of care is enhanced with the nurse coordination. And there's a variety of nursing roles in bloodless medicine, including nursing coordination.